Welcome to the Nottingham University Hospital Trust. We understand that coming into hospital can be scary, so this video aims to take the scare out of emergency care. When you are admitted into hospital for an emergency operation, one of the first people you will meet is a surgeon. They will spend time talking to you about your symptoms and other medical conditions you may have. To make a diagnosis, blood tests, x-rays and scans may be required by your surgical team. Once the results come back, the team will know if you need an operation, which will be explained to you in detail. You will then be asked to sign a consent form. Early on, you will also meet a specialist surgical nurse, who will welcome you and go through all of the necessary paperwork for your hospital admission. You will be asked to change into a hospital gown and also special stockings that prevent blood clots. Wristbands with your name, date of birth, address, hospital number, and any allergies you may have will be attached to both wrists. We use this information to keep you safe, so please make sure this information is correct. You might not feel like eating or drinking, but if you do, you will be notified when you should stop before your operation. It is important you stay hydrated, so we will keep this time to a minimum. Depending on your surgery, you may require a drip before you go into theatre. Before your operation, an anaesthetist will come to see you to go over the details of your anaesthetic. You will be asked questions about your general health, so your care can be tailored to your needs both before and after surgery. Some patients with complex medical conditions may need to be looked after on a critical care unit. If this applies to you, your anaesthetist will explain this in greater detail. Once it's your turn to come to theatre, your patient escort will wheel you from the ward to the theatre reception. Theatre staff will double-check your details and consent form before taking you to theatre. If you use glasses, dentures or hearing aids, keep them with you until you go off to sleep. Before you go off to sleep, the surgeon, anaesthetist and theatre staff will go through some final checks with you to ensure your safety. Once these checks are complete, your anaesthetist will start the anaesthetic. After your operation, you'll be moved to a recovery room, where a dedicated recovery nurse will observe you. You may feel hazy or groggy as you come around from the anaesthetic. If so, your nurse will give you oxygen to help you feel better. If you have any questions about your operation, please don't hesitate to ask your nurse. During post-operative care, different staff members will see you at specific stages of your recovery. Your surgical team will check your wound to ensure that it's healing well. You'll be given advice on how to care for your wound and when it is safe for you to start eating and drinking again. Your nurse will observe you throughout the day, making sure you get the medicine you need. There are no prizes for bravery, so let your doctor and nurses know if you are in pain. It is important that you take part in physiotherapy treatment after surgery to reduce the chance of complications. Depending on your surgery, a dietitian may advise you on the specific diet you require during your recovery process. Once your medical team is happy for you to be discharged, a pharmacist will ensure that you are taking the right medication and will inform your GP of your progress. A copy of this letter will also be given to you. You will then receive an appointment through the post to see your consultant surgeon after a specific period of time. We value your feedback, so please remember to contact us via these websites.